I did want to take just a minute to reflect on our being awarded Foundation Trust status, because this is a massive achievement for us as an organisation as a whole, in terms of the judgments that are being made about us from our regulators, from those external assessors who have said in terms of our governance, in terms of how well led our services are, in terms of the top quality services that we provide, that we are a capable, good, strong organisation. And that's a real achievement in the current environment where the finances are tough, where the expectation, the bar is raised continually. So it's a real achievement for the whole of our organisation and for all of the staff. They should feel extremely proud to be part of that achievement. So a number of staff have said to me, what does it mean, Simon, getting to Foundation Trust, and what difference will it make? And you know, for a lot of our frontline staff delivering clinical services, they might not see any immediate changes, it might not make any difference. And in some ways I would say it shouldn't make a difference, because we've been judged to be delivering top quality services, we're well governed, we're well led in terms of our services. So the work we've been doing over the last couple of years, I would say, is what we should be doing and we should be continuing to do. In other words, we've been operating at the rules and levels expected of a Foundation Trust over the last couple of years. So in terms of immediate changes on the ground, I wouldn't expect our clinical and frontline delivery staff to see any change necessarily. What we might see in terms of becoming a Foundation Trust is a number of more subtle changes that occur over the next 12, 24, 36 months really, and this will be about a growing confidence for us about how we work with the public, and the public are now represented on a Foundation Trust through elected membership onto a governing body. So how we work with our governing body, how the public start to influence what our priorities are, what our focus should be, what local communities want to see in terms of service delivery, these are the things that might start to shape our future business plans and direction of travel. And ultimately, the way we work with our governing body and the priorities they identify and how we respond to public policy and expectation around health services and the future agenda around integration of social care and physical care and mental health care, etc., means that we as a Foundation Trust will get some opportunities to think differently about how we invest in services for the future. The last 12 months have been a really successful year for us as a trust, and it is important we reflect on the previous year when we're thinking about our plans for future years, because of course we need to build on the successes that we've had, and it has been a very successful year last year. In terms of some of the national targets and expectations, we've done really well. In terms of our financial plans and duties and responsibilities, we've hit all of the targets and expectations that we've had of us. And of course it was a really busy year for us in terms of monitoring and inspection, and last July we had the CQC, the Care Quality Commission, who undertook their their national inspection of us, for which we got an outcome of good across the 5 domains in total. So as well as national targets and national requirements, of course it's really important that we continue to deliver the quality and improve our services at a local level for our local population, and we've got lots of really good examples from last year of things we did. So earlier on in the year, Bracken Ward opened, which is our new functional assessment ward for older people up at Airedale Mental Health Unit. We've worked hard to make sure that we're one of the few trusts in the region that has delivered on our health visitor national target requirement, which means we've recruited more and we've got more health visitors in place over the course of last year. And of course the other thing that we've done is to really move forward on our agile working programme. So we've equipped 1,300 of our community staff with mobile technology, so that they can really start to think now about how they work most effectively in a community setting, how we reduce the amount of hours and travel for them. We're really excited about putting in place a new programme last year of staff development. So this is particularly aimed at BME Band 5 and 6 staff. We've called it Moving Forward. So it's about helping people with their career progression and their aspirations into leadership. So I think we've ended the year with a good reflection in terms of our successes when we look at friends and family test and when we look at the staff survey. So we've had some really positive outcomes in both of those areas, which really add to all of the work that we've achieved over the last year. So my reflection on the last 12 months is that we're in a really strong position. We've delivered some great services, we've got some great outcomes to our assessments, the hurdles we've had to jump, and we're in a really strong position for starting 2015-16. So the Trust has got a vision to deliver the best possible care to the people of Bradford, Airedale and Craven. And that vision is really important at the beginning of any plan. And it's what we believe in, it's what's important to us as an organisation. We've developed a vision wheel that sits around that vision. And that vision wheel encapsulates what we're about, what we're focused on. So You and Your Care focuses on service users, their carers. That's surrounded by our 5 values. These underpin our behaviours as an organisation, as individuals working within the organisation. And then surrounding that, we've got 4 outcome areas. So we refer to these as the 4 quadrants, which set out how we're going to measure ourselves and how we know when we're delivering the best possible care. So clearly our vision and our vision wheel needs to underpin the whole of our annual plan for this year. So if we take one of those quadrants, which is quality, then we define quality as safe, personal and effective. And as an organisation, what we've agreed to do and what you'll see in the annual plan is a real focus on a number of quality goals that set out how we're going to measure safe, personal and effective. So we've identified 9 areas that make up our quality goals for this year that are underpinning safe, personal and effective care. So our aspiration, our goal as an organisation is that we should be measured and found to be achieving in the top quartile of all like trusts across each of these measurement areas. Over the last few years, we've spent a lot of our capital money and time on focusing on improving our inpatient environments, and that's continuing into this year. And we've got a couple of exciting developments really. One which is around our dementia assessment services. So currently Ward 24 at Airedale Hospital is planned to move over to the Linfield Mount site in a purpose-designed unit, which is our new dementia assessment ward, and that's due to open in August of this year. We're really excited about Daisy Hill House, our new intensive therapy centre that's opening in June of this year. This is again a purpose-designed and purpose refurbished unit that is going to be available nationally. It's a 6-bedded unit for females who have got complex emotional distress and disorders. And this is an opportunity for us to market new services, to deliver what is pretty much one of a kind across the country, working in a very psychological therapy orientated way. So it's really important during the course of this year and moving forward that we work really closely with the local authority. And the local authority are focusing on their children's pathways and the redesign of children's pathways. So they're working alongside our health visitors and looking at co-location around children's centres and the streamlining of those pathways. So community nursing is one of the areas we're going to focus on this year. It's very much about working alongside our commissioning colleagues and our acute trust partners. So we've got a slightly different approach in Airedale and Craven than we have in Bradford, but basically this is about looking at our out-of-hours services, looking at our specialist community nursing services, looking at how they align with the intermediate care services that are provided in each of our acute trusts, and pulling together a new specification for community out-of-hours services. So over the last 12 months, we've been really focused on finding a different approach to how we involve service users, carers, how we engage our local community. And we've pulled all of this together under a work strand called You and Your Care. And there's a number of pieces of work that are falling out of that we're going to implement this year. So one of those developments is around a carers hub. So we're going to start thinking about how we use volunteers to support carers, how we provide information for carers, how we provide a real focus on a different area for carers to get support, help and respite. We're really keen and interested to develop opportunities for people with mental health problems to get back into employment. We're working as one of the national pilot sites with some joint funding. We've put in place a number of new employment workers, and we've set ourselves a target of identifying 60 places in our local community, in local employers' workplaces for people with mental health problems. Smoke-free targets is a really key area for us as an organisation. People with severe and enduring mental health problems are far more likely to die earlier from smoke-related problems, from poor exercise, from the medication and the side effects and complexities associated with the medication they take. And as an organisation that's really keen to promote health and well-being, I think it's a very important statement that we move to a smoke-free inpatient environment. So across our 2 mental health sites from the 1st of July, we will be a smoke-free environment. And that means for patients, for visitors and for staff. What's really important in our plan for this year is that we really embed new ways of working for our community teams. So 1,300 of our community staff have got mobile technology now that they're getting used to, working with. So we'll be doing a lot of organisational development, team development work with community teams, getting them to think about their flow of work, their work patterns, how often they travel back to base, when they have team meetings, how they work on the go. And as part of that, it's really important that we start to gather baseline data, an important part of this year's rollout of Agile Working. All of our plans for next year are absolutely dependent on the right staff with the right skills in the right place, supporting us in delivering those programmes of care. So how we prepare our staff, how we develop and train our staff is absolutely crucial to us as an organisation. And we've got some big plans for next year. For all of the staff that work in our organisation, showing and displaying leadership is a really important part of what we do. Leadership resides in everybody, and that leadership is really about living our life through our values. So last year we started an extensive rollout to over 500 members of staff, band 6 and above, all of our leaders, a new leadership development programme, which is a modular programme focused on change management, working with individuals, working with teams, how to bring the best out of teams. So we're going through a rollout right the way from everybody at band 6 right the way up to chief executive level on this programme. And in September we'll see another 250 senior leaders going through that programme. We're really keen to make sure that as well as all of our band 6 and above managers get involved in a leadership programme, that we put on specific programmes for professional groups as well. And this year we're really going to focus on a medical leadership programme. Part of leadership development requires an ongoing support, supervision and coaching opportunities for staff. So we don't just want to provide courses and development opportunities, we also want to make sure that staff get the opportunity to embed what they're learning, to reflect on their practice, to try out and practice with a coach, with someone to help and supervise and support them through the change process they're going through. I'm sure a lot of staff will recall our groundbreaking and award-winning Exciting Futures programme that we ran a couple of years ago. It ran for 3 or 4 years, and this was really focused on offering an opportunity for staff to work in very different ways with different teams, to make a different emotional connection with who we are and what we do and how we work as an organisation. It was a very successful programme and we want to bring it back. So watch this space. Later in this year we're going to be doing something around Exciting Futures too. We all know that the current situation in terms of public services, in terms of the financial position nationally, is one of a huge challenge. And so therefore how services are going to shape up, what's important, what strategically we should be thinking about and how that translates into local plans beyond this year is really important to us. And we as a trust board and an organisation have spent some time thinking about what are the important areas of policy, of service development, what does it say in NHS England's forward view about how services are going to be provided. The triple integration challenge, so that's thinking about mental health and physical health, around primary care and hospital-based services, around social care and health care. How these things are going to look in the future have to be part of our thinking and preparation for our future plans. So as part of that thinking, the Trust Board have identified 5 areas that they think we as an organisation ought to be starting to think about and ought to be influencing the way we work this year and certainly our plans as we move into the new year in 12 months' time. So the first of those areas is around what I'd call personalisation. So it's about the individual, the person who uses and accesses our services. They're going to be a very different type of interaction in the future in terms of empowerment of individuals, in terms of self-care, self-help and self-support, and the expectation that there is that people will start to take greater responsibility around their own personal health and needs, how they interact with the community and how the community supports individuals. So the second area will be about how we start to join up our thinking and work jointly and put together joint development with the third sector will be another influencing factor on how we work going forward. So one of the greatest changes I think that has started to be identified by the public, by politicians, by NHS England is that primary care must reform. That initial entry point, that gateway of entry into healthcare has got to start operating very differently. The future looks different in terms of access to and availability of GPs, making primary care 24/7. So how we as a community-based organisation work closely with primary care in different models of working, in different solutions for those individuals with chronic and long-term needs, supporting them in their own home and keeping them out of hospital will be part of our focus going forward. So the fourth area that we've talked about as a board is how we work with our public sector partners. So I'm thinking about social care, adult and children's, I'm thinking about Airedale Hospital Trust, I'm thinking about Bradford Teaching Hospitals Trust, and I'm thinking about wider networks across West Yorkshire, whether that be mental health networks or community health networks, then how we work with the statutory sector in providing different pathways and models of care has to be part of our thinking also. So the final area that Trust Board thought was really important to start influencing our plans going forward was around digital technology and digital healthcare, and just trying to think about the service user of the future and how savvy they will be in terms of access to remote working, in terms of thinking differently about instantaneous information, about where and how they seek advice, about how they set up social networks and talk with others about health and healthcare needs. So we as an organisation have got to respond to that and start thinking very differently about the provision of services in a digital age.